Now we will discuss about the Code of Ethics as advised by Indian Nursing Council. Indian Nursing Council INC also recommends practice of Code of Ethics by all nurses working in India. According to INC Code of Ethics for nurses, the Code of Ethics identifies the core value of nursing profession and establishes the standard of conduct that are expected from all nurses who work in India. The Code of Ethics described by INC are: number one, the nurse respects the uniqueness of individual in provision of care. So here we can say that this Code of Ethics tells us that nurse provide care to the individual without consideration of caste, creed, religion, culture, ethnicity, gender, socio-economic and political status, personal attributes, or any other ground. Means she never judge the client based on these things. Just provide best care to the client. Individualizes the care considering the belief, values, and cultural sensitivities. The nurse appreciates the place of individual in the family and community and facilitate participation of significant others in care, develop and promote trustful relationship with the individuals, and recognize uniqueness of response of the individual to interventions and adapt accordingly. She respects the client as an individual. The nurse respects the right of individual as partner in care and help in making informed choices. So according to this code of ethics, the nurse should appreciate the individual right to make a decision, and while providing care, we should understand that the client is partner in his own care, and we should take all respect and we should give respect to all the decisions. And for this, we should provide proper information for informed consent and enable the client to make informed decisions or informed choices. The nurse respect the decision made by individual regarding their care, promote public, or we can say protect public from misinformation and misinterpretation. So while providing information for informed consent, we should gather information. We should provide the information in two ways. We should assess that whether the client has received the information as we want to give. For this, we ask questions. Advocate special provision to protect vulnerable individuals and groups. That's why in nursing we always say that nurse is the best advocate for the patient or client. Third code of ethics is the nurse respects individual right to privacy, maintain confidentiality, and share information judicially. Means the nurse respects the individual right of privacy of their personal information. Not only personal information, physical privacy is also maintained while providing or giving any nursing care. And if we have some confidential information, that should not be shared to everyone, but based on the life threatening situation, that can be shared to specific authorities and use judgment for this. The nurse take informed consent and maintain anonymity when the information is required for quality assurance, academic and legal reasons, and limit the access to all personal record, written and computerized to the authorized person only. Not everyone should go and can have access to these records. That should be safeguarded. Next is nurse maintains competence in order to render quality nursing care. This is very important. The nursing care must be provided only by registered nurse because the client's life is in our hands. The nurse strive to maintain quality nursing care and uphold the standard of care. Nurse value continuing education because to maintain the competency we need, initiate and utilize all opportunities for self-development as well as professional growth. Nurses value the research as mean of development of nursing profession and participate in nursing research adhering to the ethical principles. Fifth is the nurse is obliged to practice within the framework of ethical, professional and legal boundaries. The nurse adheres to the code of ethics and code of professional conduct for nurses in India developed by Indian Nursing Council. Familiarize with the relevant laws and practices in accordance with the law of state. Means every nurse should know the laws, and based on these laws we have legal responsibility while providing care along with these code of conducts. Nurses are obliged to work harmoniously with members of health team. The nurses appreciate the team efforts, rendering care, cooperate, coordinate and collaborate with members of health team to meet the need of our client. Nurses commits to reciprocate the trust invested in nursing profession by the society. The nurse demonstrate personal etiquettes in all dealings while in service or dealing in the personal life. She should use the etiquettes like politeness, good listener, cooperative, soft spoken, etc. And she should also demonstrate the professional attributes in all dealings, such as organized, proactive, skilled, adaptive, and insightful. So, dear students, we should all follow this code of ethics so that we can provide better nursing care and we can justice with our service with our profession. Thank you.
My student support system. Keep watching, keep learning.